Hello, my name is Jack Tyndall, and today I will be giving a brief presentation on the pathogen known as Acinetobacter baumanii, which is more commonly known as Iraqibacter. In this presentation, I will be going over the history and significance of this pathogen, as well as some risk factors for infection, ways that the pathogen interacts with its host, and some ways that we can treat individuals that are infected with this pathogen. So to begin, we'll go over some history of this pathogen. The first isolated case of Acinetobacter baumanii was found in 1911 by M.W. Beijerinck, and it wasn't until the 1990s that the first antibiotic-resistant strain of Acinetobacter baumanii was isolated. And so throughout the 1900s up until 1990, a lot of the infection cases with this pathogen were treated relatively easily. But over the last 3 decades, Acinetobacter baumanii has shown a growing resistance to antibiotic drugs, which has made it very difficult to treat, and is now classified as an escape pathogen, which is one of 6 escape pathogens in the world. So the significance behind this pathogen is that it is very resistant to antibiotics, and it can also survive wet, dry, and abiotic surfaces for long periods of time. And so its antibiotic resistance is characterized by its ability to acquire resistance genes, and it also contains efflux pumps that make it resistant to tetracycline. So some risk factors for infection. The pathogen poses the greatest threat to individuals with weakened immune systems. So for example, individuals suffering from respiratory tract infections, urinary tract infections, pneumonia, meningitis, and other types of infections can be severely hurt if they are infected with Acinetobacter baumanii. This pathogen can also cause infection via invasive medical equipment, such as ventilators or catheters. And that's why patients in the intensive care units in hospitals are at great risk for infection. The pathogen Acinetobacter baumanii also runs rampant in the military, especially in the Iraq War. Due to blood pathogen contact, injured soldiers are at great risk for this infection. And so, as I was just saying, the armed forces that are deployed to battlefields in Iraq and throughout the Middle East are very susceptible to infection. And that's due to the dry, sandy conditions that serve as an ideal environment for this pathogen. And due to this pathogen's ability to cause infection throughout the military, it's been nicknamed Iraqibacter. And so this pathogen is a gram-negative bacteria, which means it contains a cell wall and an outer membrane. And even though it is non-motile, which means it lacks a flagella, it does contain porins and efflux channels, which contribute to its antibiotic resistance. And Acinetobacter baumanii can also cause apoptosis to epithelial cells, as it contains an outer membrane protein called OMP38. And so even though this pathogen is very difficult to treat, there are a few ways we can help with infections. Drugs known as polymyxins and also tetracycline derivatives can help with treating this infection. And it's also very important to prevent the infection from occurring in the first place, especially in hospitals, with good sanitation habits such as washing your hands, properly sanitizing medical equipment, and wearing masks. And so that concludes my presentation of Acinetobacter baumanii. Here are some references that I used to put this presentation together, and I hope you have a great day.